All right, so we're gonna go ahead and head to the med room because we have orders to give some medications to our patient, Erica Trapp. So first off, we'll go ahead and acquire those medications, and what we'll be doing at this moment is we're gonna be giving ondansetron, which is going to be, we need 2 milligrams, and what we'll be doing is getting that out of a 20 milliliter vial that has 4 milligrams per, or 40 milligrams per 20 milliliters, so we'll need 2 milliliters to get 4 milligrams. And then we're also going to be administering sodium chloride at a rate of 125 milliliters per hour. And then that's going to be piggybacked with our ciprofloxacin, which is going to be 400 milligrams every 12 hours. And that's going to be in an IV infusion at a rate of 200 milliliters per hour because it's in a 200 milliliter bag. And then we're just checking to make sure everything's okay there. So every 12 hours, so this is the correct time. And then for the ondansetron, we're doing that every 8 hours. And so this is also the correct time for that. So we'll go ahead and prep our meds here. So we've gotten them out of the Pyxis. So I'm gonna go ahead and perform hand hygiene as well as drop some gloves. And so we're going to start off by drawing out our medication. So we need, once again, 2 milliliters to get our 4 milligrams. Just double checking that again. Yep, 4 milligrams. So we'll go ahead and take our syringe. We'll attach it to a blunt needle. And then we'll use an alcohol wipe to clean the top of our medicine. Just double checking to make sure this is the correct med. As well again. 2 milligrams per milliliter, and we need 4 milligrams, which means we need 2 milliliters. So 15 seconds of that. We'll go ahead and uncap our needle. We're going to go ahead and take 2 milliliters of air, inject it in, and then we'll flip. And gravity's not doing its thing, or pressure's not doing its thing, so we're going to go ahead and draw out 2 milliliters. Alright. Probably should have flipped that first. And we don't have air, we're still. There we go. Perfect. Alright, so we need a tiny bit more. There we go. And that looks good. So we're going to go ahead and cap that, and we're going to go ahead and label this because we'll be bringing this over to our patient. We want to make sure we know what's what. So next we have our Cipro, and this is 400 milligrams and 200 milliliters, and this is going to be piggybacked onto our sodium chloride, which is 1,000 milliliters. So we're going to go ahead and get this set up and primed. We'll do this in the med room as well, just so it makes it easier. So we're going to get our primary tubing. Make sure everything is nice and clamped up so nothing starts leaking. It's a bit tangled. All right. Then we're going to go ahead and get this half full. And then we're going to go ahead and prime the line by unclamping everything. And then we're going to get all the air bubbles out. Unclamp it. There it goes. A bit too fast. Alright. We're going to check the line. It's kind of already pre-primed because it's a used tube, which we would not use in real life. Some air bubbles in here that we got to get out for sure. And they're flowing out nice and slowly. try to massage them out. Oops, wrong way. There's kind of a lot stuck in here, which would not work in the machine, so we just gotta see if we can get them out. Alright. And then we'll keep going a tiny bit more. Alright, we'll see how that does. So we have that primed. And then we're going to go ahead and get our secondary tubing and puncture our Cipro. So once again, we'll just double check to make sure we have the right dose, which is 400 milligrams in 200 milliliters, which is correct. And it's supposed to be administered now every 12 hours. And then we also want to make sure it's compatible as well with our Ondestrone, and that looks good because we already checked that out. So we'll go ahead and puncture our Cipro. Popping this off. Squeeze the air out. Perfect. And we want to make sure this is closed. Good. And then we're going to go ahead and attach it to a port above. And then we're going to go ahead and back prime this. So we're going to go ahead and open up this chamber slowly and wait for our saline to run up, which will push air into the bag, which is okay. We can just kind of watch it go. Good. We'll fill the chamber a tiny bit. Good. All right, there we go. So this is all primed. We have those set. We have our Ondestrone here. We're gonna go ahead and add a label to the tubing while we're here. And then since this isn't a constant infusion, it'll need to be changed every 24 hours. And then we're gonna go ahead and take off our gloves. We have our 2 flushes. We have some alcohol wipes. We'll toss everything else. We need our lower hook hang. And then the Ondestrone would stay in the bedroom. Then we'll go ahead and bring all of our equipment in. And lastly, I'm just going to go ahead and take a look at the patient, make sure they have no allergies. So this stuff looks good. All right. So we'll head over to the patient's room. We'll check for precautions. I see just basic contact precautions. So nothing to worry about there in terms of PPE. We'll just be using gloves as normal. So we'll go ahead and knock, knock, knock. Hi there, Erica. My name's Carmiel. I've got some orders here. We're gonna go ahead and give you your ciprofloxacin as well as your Ondestrone. So I'm gonna have you verify your name and date of birth. Could I have you say those, please? Perfect. All right, looks good. Now I'm gonna go ahead and check that against your wristband and they match up. Awesome, Erica. So we're gonna go ahead and get these meds going. I'm gonna go ahead and glove up and I'll perform hand hygiene. Grab some gloves. How's your day been so far, Erica? Right on. Are you in any pain right now? A bit? Okay. Well, these meds are gonna help that. One of them, the first one we'll be doing, is gonna help with your nausea. Are you feeling nauseous right now? Gotcha, okay. And then the second one's gonna help with that UTI we've got going on. So I hope that it helps make you feel better, and we'll check in later with you to make sure they are. But we'll go ahead and get those going right now. So we're gonna go ahead up to the computer and we'll scan in Erica. All right, that's scanned. Around the mark. Yep. Perfect. All right, we got the right person. And then we're gonna go ahead and do the 5 rights again. So we'll go ahead and start off with your Ondestrone. So we're gonna go ahead and take a look here. And we have the correct dose, 4 milligrams in 2 milliliters. We have the correct time, good, within an hour of the time to administer. The correct patient, the correct medication, and the right route, which is IV. So we're gonna go ahead and start off with this, Erica. We're gonna check your, we're gonna go ahead and check your IV to make sure it's flushing all right. So we'll remove an alcohol pad. We'll swab this for 15 seconds, make sure to get in every groove. And then we're going to go ahead and test the flush. So I'm going to go ahead and palpate for the vein. I might pulse a bit to see if I can feel the pulsing. Feels good. All right, Erica, we're going to go ahead and get that going in. It's nice and slow, checking it out. Any pain there? Feeling good? All right, right on. So we're going to go ahead and just flush 5 or 10 milliliters. Perfect. All right, so we're going to go ahead and give you your meds now. So I'll unscrew that. I've already done my 5 right here. Put that at the table. And at the MAR, so once again though, we'll just do it again. On Desterone, we're looking for 4 milligrams, so in 2 milliliters, that's looking correct. The right person, the right time, the right route. So I'll go ahead and toss the flush. And then we're going to be administering this over 2 minutes. So I'm going to go ahead and push. Just nice and slowly. A minute has passed, 1 milliliter has gone in, and then push again after the next minute. So that's 2 milliliters in 2 minutes. Good. And then we're going to also scan this med in, which should have done beforehand, but it's all good. So we're going to go ahead and unscrew this, and then we're going to go ahead and flush again to make sure that no medicine's hanging out in the line. That's working well. Good. I don't have to do that again because we know it's flushing A-okay. And then I'm just looking around to make sure it doesn't look infiltrated at all. Everything looks nice and fine. We're getting in the vein, and I could feel that by touching her vein as I was putting in and pulsing with the first flush. All right, so Erica, that was your first med. We're gonna go ahead and get your Cipro in now. So I'm gonna go ahead and scan that in as well. And so that's scanned in. It can see everything. It's telling me it's all good, the right time, the right dose, the right route, IV and all that. So we're gonna go ahead and get this set up on the machine. All right. So we'll first get the bags hung up. And let's see, we're gonna go higher on this one. Lower right here, everything's been primed and prepped. Okay. All right. And then we're closed here. So I'm gonna go ahead and this never got recapped, so we're gonna go ahead and use an alcohol wipe on that. 15 seconds later, we're gonna go ahead and get it in the machine. This one. All right, and then we'll get it set up. So it's closed right now, so it's okay to hook up to her. And then I had already sanitized it, so hasn't touched the ground or anything dirty yet. This port is also still clean because it stayed attached to the syringe. And we'll go ahead and get the machine set up. All right, let's see. We got to go out of this because it's been running the entire time. Let's see how we can go back. All right, so we're gonna, machine's already set up. Let's see, cancel, clear. Let's see, channel off. Let's try it. There we go. All right, perfect. So we're gonna go ahead and get the machine set up. So we're using channel A. We're gonna do basic infusion. And so our primary infusion is the sodium chloride. We're doing that at 125. Which I will check once again against the mark. 125 milliliters per hour, and we have 1,000 milliliters per 1 liter. All right, and then we're gonna add our secondary infusion. So we know that's Cipro, so we're gonna go ahead and find that. And then we're doing 400 milligrams in 200 milliliters, so we'll go ahead and just double check that again. Ciprofloxacin. 400 milligrams, 200 milliliters. Good. All right, and then that's what we have here as well. Perfect. So we'll add that. Yes, that is correct. Next. And then we're gonna go ahead and open up all of our channels. Checking the entire line. Good, and we'll click start. So then we'll check here to make sure it's dropping. And it's going. So that's all set. So we'll go over here and we'll make sure that we update the chart to know that the meds have been administered at this time. All right, Erica, are you experiencing any pain right now? Everything's feeling all right? Okay, so this is gonna go ahead and fuse over the next hour. If it starts beeping at all, hit your call light, which I can grab you from over there. Put it in your hand. Try not to bend your arm too much because we're right there in the crease of the elbow. We don't want to stop. And if you experience any sort of discomfort or rash or something, also hit that call light. Come let us know as soon as possible, okay? So we've got that. That's all set. Alrighty. So we're gonna go ahead and deglove. We're gonna go ahead and perform hand hygiene. Erica's got her call light. Let us know if there's anything else you can do for you. We've already documented, and we're all set.